What is vitamin B12? Understanding vitamin B12 benefits, sources, and importance for your health. Vitamin B12, also known as cobalamin, is an essential soluble vitamin that plays a crucial role in various bodily functions. It is one of the 8 B vitamins and is unique among them due to its complex molecular structure containing a cobalt atom at its center. Key functions of vitamin B12. DNA synthesis. Vitamin B12 is involved in the synthesis of DNA, the genetic material found in all cells. It is essential for cell division and growth. Red blood cell production. Vitamin B12 is crucial for the formulation and maturation of the red blood cells. It works in the conjunction with folic acid, which is also another B vitamin, to ensure healthy blood cells and prevent anemia. Nervous system support. The vitamin plays a vital role in maintaining the health of the nervous system. It aids in the production of myelin, a protective sheath around the nerve fibers that allows for proper nerve signal transmissions. Sources of vitamin B12. Vitamin B12 is naturally present in certain animal-based foods including meat, beef, lamb, pork, and organ meats, liver, kidney, etc. Poultry, chicken, turkey, and duck, fish and seafood, salmon, trout, tuna, clams, and oysters, dairy productions, milk, cheese, yogurt, and eggs. Additionally, some fortified foods and supplements are available for individuals following a vegan or vegetarian diet who may have difficulty obtaining sufficient vitamin B12 from natural food sources. Importance of vitamin B12. Adequate intake of vitamin B12 is crucial for overall health and well-being. It is essential for maintaining healthy red blood cells, neurological function, and DNA synthesis. A deficiency in vitamin B12 can lead to various health issues such as pernicious anemia, neurological problems, fatigue, and weakness. Individuals at risk of deficiency. Some people are at higher risk of developing a vitamin B12 deficiency, including vegans and vegetarians who do not consume animal-based foods, other adults with reduced absorption due to age-related changes in the digestive system, individuals with gastrointestinal disorders that affect nutritional absorption, those who have undergone certain types of gastrointestinal surgeries that may have impact nutrition absorption, supplementation, and medical advice. If you suspect a vitamin B12 deficiency or have specific health concerns, it is essential to seek a medical advice. Depending on your individual circumstances, your healthcare provider may recommend supplementation or specific dietary changes to address the deficiency effectively. As with nutritional information, it's essential to rely on reputable sources and consult healthcare professionals for personalized advice and guidance. Health benefits of vitamin B12. Vitamin B12 also, as previously mentioned, as cobalamin, offers a range of health benefits due to its critical role in various physiological processes. Here are some of the key health benefits associated with vitamin B12. Energy production. Vitamin B12 is essential for converting food into energy. It plays a crucial role in the metabolism of carbohydrates, fats, and proteins, providing the body with the energy it needs to function optimally. Red blood cell formation. Vitamin B12 is vital for the production and maturation of red blood cells. These cells are responsible for carrying our oxygen throughout the body. Adequate vitamin B12 levels help prevent anemia, a condition characterized by low red blood cells count, which can lead to fatigue and weakness. Nervous system health. Vitamin B12 plays a key role in maintaining the health of the nervous system. It supports the synthesis of myelin, a protective sheath around the nerve fibers that facilitates efficient nerve signal transmission. Proper nerve function is essential for muscle control, reflexes, and overall neurological health. Cognitive function. Some research suggests that vitamin B12 may contribute to cognitive health and it may help reduce the risk of cognitive decline as people age. However, more research is needed to fully understand the impact on cognitive functions. Cardiovascular health. Vitamin B12 is conjunction with folate, helps in metabolizing homocysteine and amino acid. Elevated levels of homocysteine are associated with an increased risk of cardiovascular disease. Adequate vitamin B12 intake is essential for maintaining heart health, mood, and mental well-being. Vitamin B12 is thought to play a role in regulating mood and mental well-being. Some studies suggest that low levels of vitamin B12 may be associated with an increased risk of mood disorders such as depression and anxiety, cell growth, and DNA synthesis. Vitamin B12 is crucial for cell division and DNA synthesis. Proper DNA synthesis is necessary for cell growth, repair, and maintenance, which are essential for overall health and tissue regeneration. Healthy skin, hair, and nails. Adequate vitamin B12 levels contribute to healthy skin, hair, and nails. It supports the turnover of skin cells and aids the formation of red blood cells, which carry oxygen and nutrition to hair follicles and nail beds. Sources of vitamin B12. As we previously mentioned, you can get vitamin B12 from meat, beef, lamb, pork, and poultry, chicken, turkey. They are all rich of vitamin B12. Fish and seafood. Fish such as salmon, trout, tuna, and sardines are good sources of vitamin B12. Shellfish like clams, mussels, oysters, and crabs also contain significant amounts of this vitamin. Dairy products, milk, cheese, yogurt, and other dairy products are good sources of vitamin B12. Look for fortified dairy alternatives made from soy, almond, or coconut milk if you follow a vegan or lactose-free diet. Eggs. Both the yolk and the white of eggs contain vitamin B12. Including eggs in your diet can contribute to your vitamin B12 intake. Fortified foods. Some plant-based foods are fortified with vitamin B12 to cater to individuals following vegetarian or vegan diets. These include fortified breakfast cereals, plant-based milk, such as soy, almond, or oat milk, and nutritional yeast. White plant-based sources like fortified foods can help increase vitamin B12 intake for individuals following a vegan or vegetarian diet. It is important to note that they may not provide adequate levels for everyone. Vegans and vegetarians should consider incorporating vitamin B12 supplements or fortified foods into their diet to ensure sufficient intake. If you suspect a deficiency or have specific dietary concerns, it is advisable to consult with a healthcare professional or registered dietitian who can provide personal guidance based on your specific needs. Who is at risk of vitamin B12 deficiency? Several people are at increased risk of vitamin B12 deficiency. These risk factors can vary based on dietary habits, age, and certified medical conditions. Some of the groups are at higher risk of developing vitamin B12 deficiency. We already talked about vegans and vegetarians, but we didn't mention older adults. As people age, the body's ability to absorb vitamin B12 from food may decrease. The reduced absorption can lead to lower levels of vitamin B12 in the body over time. If you have any kind of gastrointestinal disorders, gastric surgery, you might have vitamin B12 deficiency. Pernicious anemia. Pernicious anemia is an autoimmune condition that affects the production of intrinsic factor, a protein necessary for vitamin B12 absorption in the small intestine. Individuals with pernicious anemia are at higher risk of vitamin B12 deficiency. Chronic alcoholism. Alcohol can interfere with the absorption and utilization of vitamin B12, increasing the risk of deficiency in individuals with chronic alcohol use. Medication interactions. Some medications, such as certain antacids, proton pump inhibitors, mostly known as PPI, and metformin used for diabetes, may interfere with vitamin B12 absorption. Also, malabsorption disorders, conditions that affect the absorption of nutrients in the small intestine, such as tropical sprue or short bowel syndrome, can lead to vitamin B12 deficiency. Strict dieters. People who follow very restrictive diets or severely limit their caloric intakes may not obtain enough vitamin B12 from their food choices. Breastfed infants of vegan mothers. Breast milk of vegan mothers may be low in vitamin B12, putting exclusively breastfed infants at the risk of deficiency. It is important to note that vitamin B12 deficiency can have various health implications, including anemia, neurological issues, fatigue, and more. If you fall into any of these high-risk groups or suspect a deficiency, it is essential to consult with a healthcare professional. They can perform blood tests to assess your vitamin B12 levels and recommend appropriate supplementation or dietary changes based on your individual needs. Thank you so much for watching this video. Until the next video, goodbye.